Hello, my name is Ben Davies. I'm Advanced Practice Physiotherapist at the RNHRD. In many of the rheumatology conditions we treat at RNHRD, pain is a significant symptom. It may be the first symptom that led you to seek help from your GP, resulting in the referral to the rheumatology team and ultimately a diagnosis. For most rheumatological conditions, we are fortunate to have a wide range of treatments available. And these include medications that help modify disease activity, reduce inflammation and minimise pain. And these treatments are crucial and often form the foundation of a person's management plan. They are also the focus of other bird educational videos. However, sometimes medications alone are not enough to fully manage pain or its impact on your quality of life. And this is where pain management strategies may become part of the conversation with your clinical team. To understand why these strategies can be helpful, it's important to recognise that pain is a complex experience. Human experiences such as pain are influenced by three broad areas. The first is the physical aspect, and this includes what blood tests show, what imaging demonstrates, and what we may find during a physical examination. It includes factors such as your flexibility, your fitness and strength. The second is the psychological aspect, and this will include how worried you are, stressed or low in mood you may feel. It can also include the confidence you have in your ability to cope with your condition and your outlook for the future. The third is the social aspect, and this includes the support you receive at home, at work and from family and friends. It encompasses your relationships, friendships, parenting responsibilities, caring roles, hobbies, creative outlets and your financial security. And all these factors are present in all of us to some degree, all of the time, and they interact with one another. So it's therefore not surprising that people who often feel more anxious will report more pain. Similarly, people who are experiencing depression or social isolation or high levels of life stress also tend to report more pain. And the relationship works the other way too. Pain can affect mood and emotions, place strain on relationships, limit hobbies and work, and reduce a person's sense of independence and well-being. So pain management strategies generally focus on three broad areas: maintaining your physical capability, managing stress and supporting emotional well-being, and thirdly, maintaining your social connections. Now, these areas are not listed in order of importance. Instead, it may be helpful to consider which strategies feel most relevant to your situation and then to focus on those that feel most meaningful and achievable. Firstly, physical exercise. The most appropriate form of exercise will depend on the condition that you have, and individual advice from healthcare professionals, particularly physiotherapists, may be needed. However, in general, maintaining a reasonable level of fitness, strength and flexibility is likely to benefit your overall quality of life. The key is regularity rather than intensity. Shorter periods of low to moderate intensity exercise performed consistently are often more beneficial than occasional intense exercise. Examples could include walking, Pilates, yoga, resistance exercises using body weight or gym resistance bands, or gym exercises. The best option is often the one that fits your interests, your lifestyle and the medical condition. Regular physical activity can help with everyday function as well as reducing the pain you experience. Mental relaxation, stress and mood management. Now, stress is a normal part of life, and it can be helpful to distinguish between stresses that we choose, such as taking an exam or completing a challenging workout, and stresses we don't choose, such as health conditions or difficult life events. And it's often these latter that have a greater impact on pain. There are many strategies that can help manage stress. These can include simple breathing exercises, progressive muscle relaxation, listening to music, using mindfulness apps such as Calm or Headspace, spending quiet time outside, noticing the sights and sounds around you. When pain begins to feel overwhelming, practicing these techniques regularly can help reduce both muscle tension and mental stress, which may in turn help reduce pain. It's also common for long-term health conditions to affect emotional well-being. Recognizing when anxiety or depression are becoming problematic may be a sign that additional support could be helpful. Talking therapies can be very effective. Seeking this type of support does not mean that pain is all in your head or that it's not real. Rather, talking therapies can help us understand how we respond to these challenges, how we speak to ourselves, and how past experiences might influence our confidence and coping strategies. Approaches such as cognitive behavioural therapy and compassion-focused therapy can help people develop healthier and more supportive ways of thinking about themselves and their condition. And this often has a positive impact on overall well-being and, again, can influence how pain is experienced. Thirdly, social connections and meaningful activity. When pain becomes a significant problem, hobbies may be reduced or stopped altogether. Working hours may decrease and some people may leave employment entirely. These changes can affect our sense of purpose, identity and self-worth. Losing meaningful activities, whether paid or unpaid, can leave more time and mental space to focus on pain. Conversely, maintaining social connections and participating in meaningful activities can have a powerful, positive effect on well-being and pain management. This might include paid employment, volunteering, hobbies, creative activities, shared enjoyable experiences with other people. Occupational therapists are particularly skilled at helping people identify adaptations and strategies that allow them to continue participating in activities they value most. Historically, pain management approaches were often described as ways of helping people live well despite pain, rather than reducing the pain itself. However, the evidence is evolving. Increasingly, we understand that these approaches can genuinely contribute to pain reduction. Rather than viewing them simply as coping strategies, we can think of them as pain-reducing interventions that work alongside the medications you've been prescribed. I cannot promise that these approaches will make you pain-free. However, I'm confident that if you maintain a good level of fitness, develop effective stress management skills, and remain socially connected and engaged in meaningful activities, you are likely to experience a better quality of life than if these areas were neglected. So to summarise, being less fit, more stressed, more socially isolated is likely to worsen your overall quality of life. While these changes are not easy to make, regular exercise, effective stress management, and maintaining an active role within your community can contribute to better well-being. They may well also help to reduce pain, even if they do not eliminate it completely. And so together with the medical treatments prescribed by your healthcare team, these strategies can play an important role in helping you live well with your condition. I hope this video has been useful for you, and thank you very much for watching.